Good afternoon. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine, who answers your COVID questions every Tuesday on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be answering viewer-submitted questions and addressing the latest COVID headlines through today, the 12th of July. We invite you to submit your questions via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. And leading the discussion today is myself, Sophie Bukowski, a student research assistant with the Institute. So Dr. Murphy, I'm going to start with some updated COVID statistics.
Great, thank you, Sophie.
In the United States, yesterday, we saw 175,000 positive new cases, with our 7-day average now hitting roughly 117,000 positive cases, with an 8% increase over the last 7 days. Hospitalizations have increased by 17%. Fortunately, deaths have decreased by 2%. But in Illinois, yesterday, we saw nearly 12,000 positive new cases, with our 7-day average hitting about 4,500 positive cases per day. Cases are increasing by 18%. Hospitalizations are also increasing by 14%. And like the rest of the country, the death rate is also decreasing. Okay, what can you tell us about this massive spike in cases that occurred yesterday across the US?
Well, remember, and we're going to talk about it, I think, later with one of your headlines that you've uncovered, is that the counting is pretty much very much undercounted because so many people are getting tested at home, and those tests aren't included in these particular figures. So the numbers jump around all over the place. However, you still want to look at the trend. I mean, we are counting something. We're counting all the tests that are being done at certified laboratories around the country. And those are real results. They're reported by the laboratories. So there's a positive test result attached to a patient in each one of those. And they have to give patient identifiers so that they don't double count them in case a person had 2 or 3 different tests at different places. But anyway, the cases aren't going down. They're in this 100,000 range, which is not decreasing at all. And I think everybody knows that they know somebody who just had COVID, or they're in a cluster of people that have had COVID recently. But the hard numbers here are looking at hospitalizations and deaths, because those are very easy to count. And the hospitals count them. And when you come in the hospital, you're going to get tested, whether it's for a test or whether you're an inpatient for some other reason, or you have COVID. Those numbers are firm. So those are okay. And those are not changing too much. They're creeping up a little bit, but in general, the death rate average is between 300 and 400 people per day. If you look at the average of flu per day, it's 100. But of course, with flu, it's mostly in the late fall, winter, early spring, and then not too much in the summer and fall, early fall. So it's not evenly spread. Whereas COVID doesn't seem to know the seasons, and it's pretty stable. We've had peaks. Remember, we had the Delta peak and all these other peaks in the middle of the summer, so kind of anything goes with COVID. Like those summer colds, a lot of them were due to coronaviruses, not COVID, but the other ones. There's 4 other ones that cause a common cold. So anyway, it looks like those hospitalization rates and the death rate are stable. They're more than flu, they're more than accidents, they're more than suicide, other common causes of death, but they're less than heart disease and cancer. So COVID is the 3rd leading cause of death now in the United States, out of nowhere. Anyhow, where are we with this? It's not going away. I've seen a couple headlines recently. COVID is not done with us. And that is really true. COVID's not done with it. We're not done yet.
Wow. This ties for all the numbers and all of the explaining that you just did, Dr. Murphy, ties right into our first big headline, which is, unfortunately, that these numbers are massively undercounted. So the United States is undercounted, with a huge blind spot as BA.5 becomes the dominant variant. What can you tell us about the actual true number that scientists are now saying is accurate?
Yeah, this is a very good story. It's there are several groups reporting this, and we've mentioned it many times about the undercounting. I just mentioned it a couple minutes ago. But this is actually some real data in how the counting is done. This is being reported by CNN. And it looks like, if you look at travelers who are testing positive, so they have to get tested, otherwise they wouldn't be tested in a certified laboratory. That number is about 5% being positive. So if you extrapolate that, there's something about 7 to 10 times more infections going on than is being reported. Now, remember, the hospitalization and the death rate are the same. However, that's almost 700,000. That means 700,000 to 1 million cases a day. That's a lot of COVID. The reason why that's important is because the more the faster it replicates, the more it's replicating, the more it can mutate, the more variants are going to emerge, because you really don't have, it's really not under control at all. And so we are going to see the new variants that we're actually going to talk about kind of in the next question, so I'll save it for then. But we're not, and people have really pretty much, politicians, a lot of the public health people, most of the public. I just got off an airplane, transatlantic airplane this morning. I would say maybe a handful of people had masks and none of the crew was wearing a mask. And they made a nice announcement, don't make fun of people who are wearing a mask. I mean, like, ugh. But anyway, in Europe here where I am right now, it's a little bit more mask wearing, but really not a lot. So it's, people have just basically just given up in trying to mitigate using, a way that we know that prevents the spread, which is masks and social distancing. We've given up on that, and that may have been a little bit too soon. But the good news is the hospitalization and the death rate are the same. I'm in France right now. The hospitalization rate has crept up higher than it has in the United States. And so there's a little bit more of a concern. And some places in Europe are starting to put some small mask mandates back into place. This is here is going into big time tourist season, which actually starts this week. Mid-July is kind of the beginning of the exodus for Europeans to go on their vacation, plus people to come and visit. So this is going to lead to, a lot more cases here as well. And in the United States, people moving around with the holidays and traveling by airplane, not wearing a mask in the airports and whatever. So I guess that's just the way it's going to go and how we're going to have to live with it right now, as long as that hospitalization rate and death rate stays where it is.
Yeah. Wow. This also ties right into our second big headline, which is that as these numbers are increasing, we need better vaccines. And so the FDA advisors recommended updating the boosters targeting forms of Omicron. What can you tell us about what is going on with these updated boosters?
Yeah, we've been discussing this for a few weeks now. The FDA advisory panel has met and highly recommended that the new variants are included in the next version of the vaccine, which we all knew was coming. Just like the flu, every year there's a new flu vaccine. But these things, you just don't turn a switch and get the new one. You have to gear up, change everything. And now we have BA5 that's really taken over worldwide, and here in the United States, it's well over 50% now of all the new cases. It's highly, highly transmissible. The antibody protection we have from the other Omicron variants and from the other COVID variants besides Omicron really don't work at all. And that's why the case numbers are so high. Now, you have this other type of immunity, your cellular immunity that you does stay preserved so far. And that's what's keeping the hospitals, the severe disease rate down. Now, of course, the people really at risk are older, people with underlying diseases. You look at the actual people who are dying from this, most of them are over 75, about 2/3, and they've got underlying diseases, whether they're vaccinated or not. So this is, kind of the new reality because of these highly contagious variants. There's another one reported in India, BA.2.75, that is even more virulent and or more contagious than BA.5. There have been a couple cases, really a handful of cases reported in the United States, but whether or not that takes hold in the US, we don't know if BA.5 is going to beat it out or not. BA.5 is bad enough. All right, and 4 and 5 together are what we really have to worry about. But what Moderna had said in the press, quoting them in the New York Times, if they want to make these new vaccines, they're assuming no data to assess the vaccine at all. In a way, they just don't have time to do it. It's the same thing with the flu shots. They don't have time to test it against the flu. I mean, otherwise the whole flu season will be over. And now instead of September, what I had been hearing September, October, in this quote, it's October or November. So, to get this geared up for either one of the big main manufacturers, vaccine manufacturers, it's going to take a while. But I think people need to keep in mind preventing the severe disease, hospitalization, and death for the very high risk people for the most part, is you do still get protection from being fully vaccinated, being boosted with 1 shot, and being boosted with 2 shots. Those all still give you a benefit. And then most likely what will happen, if compared to how everything else has gone, when the new vaccine comes out in the fall, when you get your flu shot, you should get the new vaccine as well. And you can get them actually at the same time. So that would be a good time to get the new COVID vaccine. And that will help you even more. And so this is basically the game we play now.
Wow. No. And our first COVID question, Dr. Murphy, that I want to go over ties a bit into our 2 headlines, which is this indoor safety with airlines. So this person says, I am fully vaccinated and double boosted with high blood pressure and being overweight. I wear my mask anytime I'm indoors. I purchased airline tickets. I purchased an airline ticket. It's a 4-hour flight when the airline mask mandates were still in place. This individual is nervous about flying. Should they keep their mask on the entire time? As you know, the numbers are spiking. What should this individual do, Dr. Murphy? Yeah.
So, being in a close quarters, indoors, which includes being on an airplane, a train, or a bus, or, it could be anywhere really, will be mitigated somewhat by wearing a good mask. So, and then there's different levels of masks. The N95 mask works the best. 2 surgical masks together works second best, 1 surgical mask, third best, and so forth. So there's a gradation. And the longer you have it on, the more you're protected. Now, whether you can take your mask off for a couple of minutes to have a drink of water or whatever, I don't think that's going to make a gigantic difference. But, half the flight is, or is it a couple minutes, whatever it is. But what this person is concerned about, and what everyone is that, even though they're vaccinated and stuff, they are at somewhat high risk. And so those people need to be very, very careful.
Wonderful. And now for our second and last COVID question. Dr. Murphy, after having COVID a few months ago, I began to experience hair loss. I'm truly not sure what to do. I have read in some places that people are taking anti-herpes medication, and that is actually helping, but there is no study to prove that. What would you recommend doing?
Yeah, so this was kind of news to me, these stories about the hair loss, and it appears that it's not specifically related to COVID, at least what people think now. But of course, the more we look at it, the more we'll learn. We didn't even know at the beginning of COVID about the smell, the loss of smell. That's very common in COVID infection. And, when you start, all you have to do is start asking people, are you having problems with smell? Then, oh yeah, no, it's like a third to a half of people. Whereas the same thing with hair loss. If you start asking people, it's not like big clumps of hair are falling out like right away. It appears after the disease, according to these reports we're reading. But the dermatologists here we're reading about in these stories, so one from the Cleveland Clinic and one from the University of Utah Health, they're saying COVID itself, just the idea of COVID in the population is stressful. Look at all the stress that even occurs in people sort of forced to go back into the workplace, people in the airplanes or the public transportation. It's not like the old days. Now when you're in a crowded place, everybody's a little bit, even the ones that aren't wearing the mask, which is most of them, everyone's a little nervous about being packed in together, and it's just causing a lot of stress. And stress, any kind of from anything, can lead to some hair loss. So I think the take-home point here is that there's a lot of stress out there now. COVID is not done with us at this particular point in time, and that especially if you've got other underlying risk factors, everyone is concerned. But we're way ahead of where we were last year with this control of the hospitalization and the death rate. And if we keep up with our boosters and wear a mask when appropriate, and also take the medication when you do get infected, if you're eligible to take the medication. So I'm talking about Paxlovid right now, but there's others in the wings that will be coming forward. And I think what you're going to see in the future is that, and now the pharmacists can give it without even a doctor's prescription. But I think what you're going to see in the future is people are going to get tested. If they're at any kind of risk at all, they will be offered Paxlovid or whatever treatment is out there. And that's going to lower their long-term complications as well, whether you had been vaccinated or not vaccinated. So that's going to be the new way of life, and until this thing kind of burns itself out. So remember, all pandemics end. It's just how much damage does it do in the interim?
Right. No, entirely. Well, those were all of our COVID questions for today. Thanks, Dr. Murphy. We'll see you next Tuesday.
Great. See you next Tuesday. And we'll do, I think, another WGN segment on Friday.
Wonderful. Thanks, everybody.